A very refreshing good morning to everyone. I'm Dr. Keyura Parakh, reader in the Department of Pediatrics and Preventive Dentistry. Here I'm presenting my short study entitled Antibacterial Property of Allopathic Medicine versus Phytomedicine against Enterococcus faecalis, an in vitro study. For the successful of any endodontic treatment, the three basic steps are instrumentation, decontamination, and obturation. Chemomechanical instrumentation removes majority of the infecting bacteria, but they're not removed completely because of the complex root canal anatomy. Hence, there is a need for more potent antibacterial agent that can be used as an intracanal medicament. Hence, in our study, we have compared few of the materials. The aim of the study was to investigate the antibacterial property of 2% povidone iodine, 50% S-cumene, 10% curcumin longa, 1.25% GAM antibiotic paste, chitosan and GAM-Chitosan combination against Enterococcus faecalis. Also, in the second step of the study, we have analyzed the sustained release property of the most effective medicament. The materials and methods used in the first step of the study to check the antibacterial property is the Agar diffusion test. E. faecalis strains cultured on brain heart infusion broth was used. Mueller-Hilton agar plates were incubated overnight at 37 degrees Celsius to maintain sterility. Then, at the center of each agar plate, a recipient well was created, which had a standardized dimension of 6 millimeter diameter and 4 millimeter depth. A standardized suspension of the organism was swabbed over the entire surface of the agar plate. 100 microliter of each sample was poured in the respective wells and left for diffusion for about 15 minutes. Then later the plates were incubated and readings were taken after 48 hours. The zone of inhibition of each medicament was measured in millimeters using the diameter of the antibacterial activity zone. And one-way ANOVA test was used to analyze their antibacterial properties. And we found that 1.25% GAM along with chitosan showed maximum zone of inhibition. Then comparison of the zone of inhibition across the group was done using Turkish multiple test comparison analysis. And we concluded that GAM-Chitosan combination followed by GAM showed the maximum and significant difference in the antibacterial activity in comparison to the other products. Chlorhexidine and Cysium cumene along with chitosan showed no significant difference in their antibacterial activity. Then in the next step of the study, the analysis of the sustained release property of GAM-Chitosan combination and GAM antibiotic paste was found out using ultraviolet spectrophotometer. Semi-permeable membrane, that is dialysis membrane 50, was soaked in phosphate buffer saline, which was maintained at a pH of 7.4. The membrane was then clamped in between the two chambers of the diffusion unit, that is here. In the upper chamber of the diffusion unit, in one of the unit, 25 ml of the GAM solution, and in the second unit, 25 ml of the GAM and chitosan combination was poured, whereas in the lower chamber of the unit, 25 ml of phosphate buffer solution was poured. And in between both the chambers, the semi-permeable membrane was clamped. The unit was then immersed in a water bath maintained at 37 degrees Celsius. Then, at predetermined intervals, 1 ml of the solution was withdrawn from the extension of the unit and replaced with an equal amount of phosphate buffer solution. The samples were then collected at every 30 minutes, and the drug concentration was determined in each sample using ultraviolet spectrophotometer. The data was tabulated and statistically analyzed using Born-Peroni post test. And we found that GAM was completely, that is 98.52% released by the end of 1.5 hours, whereas GAM and chitosan combination took around more than 4 hours for its complete release. Discussion. E. faecalis has been recovered in very high quantities from failed root canal treated teeth, and it can withstand a wide range of range of pH. Hence, it was decided to use E. faecalis for the study. The study revealed highest antibacterial activity of GAM-Chitosan, followed by 1.25% of the GAM based on zone of inhibition. Narkuncha et al. In 2010 reported that the superiority of 3M paste containing ciprofloxacin, minocycline, and metronidazole or Vitapex for root canal treatment of pulpally involved primary molars. Kim et al. And Lehner et al. Identified the discoloration caused by minocycline that was present in 3M paste. Hence, Thompson and Keller in 2010 substituted amoxicillin for minocycline in their case reports to avoid this discoloration. In this study, we have hence fabricated a new formulation of GAM containing gentamicin, amoxicillin, and metronidazole. Gentamicin has a rapid bactericidal activity and comparatively low levels of resistance. Hence, it was used to control rapid spreading infections. Also, amoxicillin targets the gram-positive microorganisms, and metronidazole shows a broad-spectrum antibiotic property against protozoa and anaerobic organisms. The topical antibiotics can sterilize the necrotic pulps of primary molars, where the systemic antibiotics are not much effective because of the lack of blood supply. The intracanal medicament used in endodontic treatments should also have a prolonged antibacterial activity. That is, it should not show a very activity for a short term of period. It should have a prolonged activity, substantivity. And therefore, the GAM was combined with Chitosan, which showed synergistic effect and good substantivity of about more than 4 hours. This was better than chlorhexidine Chitosan combination, which showed sustained release property of about 3 hours, according to Balal et al. In 2009. Curcumin longa has been shown to have a potent antibacterial activity against a number of pathogenic organisms, including Enterococcus. But in our study, the aqueous extract of curcumin longa showed minimum antibacterial activity against E. faecalis, which may be due to the low concentration of turmeric. In this study, we have used the aqueous extract of Physium cumini, whereas the methanolic extract of the peel of S. cumini was used by Priya et al. In 2013, and in both the study, we got similar results. Hence, to conclude, the GAM antibiotic combination can be used as an alternative intracanal medicament, being it the most effective antibacterial agent with good substantivity. Further studies using the same medicament in failed root canal treated cases in vitro have to be conducted. The depth of penetration in the dentinal tubules of these medicaments also need to be investigated and compared. Thank you.